Thank you for being with us for this very special presentation today. We're about to share with you our journey in this COVID-19 environment. Today we're going to focus on care within the hospital and caring for COVID-positive patients. And you'll hear from our Chief Medical Officer, Dr. David Gonzales, will be sharing a bit about his perspective on this journey. Dr. James Marx, our Executive Director of Quality and Patient Safety, will also participate, as will Dr. Theresa Ronan, who's our Medical Director of Quality, and Bree Slaughter, who's our critical care nurse who's been working in the COVID-19 unit. All of them are going to give you some very unique perspectives and information about what it means to care for this very special patient population.
We monitor the care delivered to our patients here at the hospital, measure metrics to ensure that every patient here is getting exceptional care. As the Medical Director of Quality, I have two individuals working with me to monitor our response to COVID-19. They are monitoring every patient that has been tested for COVID-19, and then we're following up on all of the positive cases. We're making sure that our care coordination team knows who has been tested positive and that those individuals receive a personalized phone call regarding their test results. These individuals on my team also monitor which patients are on the ventilator, which patients have received remdesivir, and also convalescent plasma. This information gives us greater insight into how the pandemic is affecting us here at the hospital, how it's affecting us locally. Currently, there is 16 million people that have been infected with COVID-19. 4 million of those people live within the United States, and 19.5 thousand of them live within the state of New Mexico. I think it's astounding to note that before March of 2020, COVID-19 was not in our community, and we had tested nobody for this virus. And now we have tested more than 7,100 individuals. Of those, 191 have been positive. The vast majority have recovered at home. We have hospitalized 74 different patients here. The number that I find staggering globally is that there are 16 million cases of COVID-19, and 4 days prior to that number, the case number was 15 million. So we're still rising at a very large rate across the world. As we all know, COVID-19 likes to spread in small rooms, in close encounters, through people speaking to one another. And given this, household clusters can be at risk. If one person in the home is infected, they can spread the disease to the others in their home. And we have seen 23 different household clusters. The largest family unit had 4 individuals in one home that had COVID-19. This past week, I was very optimistic. Our effective for the state of New Mexico is hovering right about 1. And what that means is that for every 1 individual that's infected with COVID-19, they infect 1 other person. The natural disease state for COVID-19 is more along the lines of 1 person infects 2 to 4 individuals. So that was a silver lining. But on July 27th, we noted that there was a spike within the state, the highest that we had seen yet, about 460 new positive cases for that day. And so I say that we're plateauing with some optimism, and I hope that this is just a one-time variance. So let's make sure to monitor ourselves for symptoms. Let's make sure to keep each other safe by wearing masks in the community, by frequently washing our hands when we're out and about and when we're at home as well.
We understand that the community is concerned about COVID-19 and possibly getting an infection while you're here in the hospital. But our process is to screen all patients who come to the hospital, regardless of what their primary diagnosis might be. And we screen people by asking them questions related to COVID, as well as assessing their symptoms and their temperature. People who have symptoms of COVID-19 are then tested, and those results are used to decide whether a patient goes into our separate COVID-19 unit or out to the general population in the hospital. Our staff is also dedicated to taking care of COVID-19 patients, and those staff do not also care for other patients in the hospital. So we have a separate wing in the hospital for COVID-19 patients. We require visitors to show their driver's license to know if they may have been coming from out of state. Especially in the time of tourist season, in the summertime, we know that there are people who come here on vacation and may have a loved one here in the hospital who gets sick. So we ask for driver's license to see if they might have had out-of-state travel. As you know, the governor's restriction currently is for 2 weeks of quarantine when you have out-of-state travel. And our hospital is responsible to make sure that visitors who come into the hospital have adhered to the governor's order for the 2-week quarantine. In addition, we do symptom screening of all visitors, making sure that someone doesn't have symptoms of COVID-19. We also take their temperature, and we also then restrict visitation to only 2 visitors per day, which allows the person who's here in the hospital to have some contact with a family member or a loved one, but it doesn't put additional risk of exposure to COVID-19 to our staff as well as other patients in the hospital. We require visitors to wear a mask while they're in the hospital. In addition, we require all of our staff to wear masks while they're working in the hospital and patients to wear masks when they're patients in the hospital, providing that their medical condition can tolerate it. CHRISTUS St.Vincent is currently offering testing for patients who are having symptoms of COVID-19 with a doctor's order. We can do testing here in the hospital for people who are having symptoms within 2 hours. For patients who can wait a little longer, we do have testing that's available within 24 hours. And then we do have send-out testing that we use for our outpatient population, which can take anywhere from 3 to 4 days. All the tests that we're currently doing are virus testing called PCR, and they require either an oral swab or a nasal swab. In addition, we do offer antibody testing for limited patients who are here in the hospital, just to be used as a screening tool. COVID-19 is spread primarily person to person through close contact, so avoiding group gatherings, avoiding celebrations or other events that bring a lot of people close together is very important to prevent transmission of disease. At CHRISTUS St.Vincent, we have cared for infectious disease patients for a very long time. We're prepared to care for people with tuberculosis and other airborne diseases through using negative pressure rooms, as well as making sure our staff is using proper personal protective equipment. I'm sure you've heard on the news that there are shortages of personal protective equipment, such as masks, gloves, gowns, and face coverings or face shields. Our hospital has done a very good job of managing our PPE supply by reprocessing primarily the N95 respirator masks, which are very short supply. We have a process of re-sterilizing them and allowing the staff to reuse the re-sterilized N95s. In addition, we switched from primarily using plastic gowns to using washable cloth gowns, which are used one time and then laundered, and then the staff is able to reuse the cloth gowns. We have face shields that the staff use that can be wiped off because they're made of plastic. And then gloves, we have an adequate supply of gloves, but gloves are only used for one patient for one time, and then they are discarded. We are not reusing the gloves. We have sufficient supplies as of today. We continue to monitor those supplies. We actually can calculate, based on the number that gets used in the prior week, how many weeks of supply that we have, and we have an adequate supply now to carry us through a couple months. But that is based on our current census of COVID patients. We have had as many as 14 patients in our COVID unit. and currently we only have 6 patients in the COVID unit. During influenza season, we often get a lot of patients who have influenza, and so the staff is used to caring for patients with respiratory diseases, which COVID-19 is a respiratory disease. Our COVID-19 unit actually is rather unique because we can care for all levels of patient in one cohorted area, regardless of their needs, whether it's critical care, step down, or medical surgical needs. Our rooms are cleaned daily. In the COVID unit, especially, we make sure that surfaces are disinfected using our hospital-approved disinfectant. In addition, we have 2 enhanced mechanisms of cleaning. One is we have a disinfectant fogger that gets used, which many people have seen on television. And then we have our UV light towers that are used to disinfect rooms. We've used our UV light towers for many years to prevent other healthcare-associated infections, so it's something that the staff is used to using and is very good with using. We also added a UV light cabinet to the COVID-19 unit where staff are able to place equipment and supplies or personal equipment or supplies that they want to have disinfected, and the UV light cabinet is also being used. The community and our staff should feel safe coming to CHRISTUS St.Vincent. We have enhanced screening precautions. We are monitoring our staff to make sure that they feel well when they come to work and no one comes to work feeling sick. Also, that any patients that develop symptoms are screened appropriately in order to keep our community safe and prevent the transmission of COVID-19.
We're starting to see an increase in patients from Santa Fe County. Early on, it was from the Navajo Nation, and we were receiving a lot of transfers from outside Santa Fe County. Santa Fe County has done a wonderful job of self-isolating as well as wearing masks, and I think to that point, that's the reason we haven't seen such a large surge. But more recently, we've started to see increasing numbers. Our numbers of positive cases are going up, and our hospitalizations have slightly ticked upward as well. We're starting to see people from the Santa Fe County. The good news is they have not required much mechanical ventilation. They've come in early, and we've been able to treat them successfully with the medications that I mentioned before. Almost all of it has been community spread. Some of it has been travel outside of New Mexico. Even short stays in Arizona and Texas have, our local residents have come back having contracted the virus. When asked what's the most important thing I can do now, is to continue to not gather in large groups. It's to self-isolate at home, and most importantly, to wear a mask. That is the number one thing that we can do to help protect our community and protect ourselves. And if you do have to go to work, definitely in the workplace, work in an isolated fashion, wear a mask, and frequent hand washing. I'm very confident we'll be practicing these same procedures until we have an effective vaccine that's widespread, that's used widespread. Until then, this is the only way we have to limit the spread of COVID-19. What those countries did very early on is they employed the same techniques we used here in Santa Fe County, but they held on to them longer. They opened up a lot later than we did. And not everybody in the United States, not all regions of the United States adhered to strict isolation as well as to masking, and therefore the spread took off more quickly. One of the successful ways to contain a virus is to have all regions of a country practice the same isolation techniques and masking together. When you have certain areas of the country that don't, it's very difficult to contain the virus. We experienced a great collaborative effort mid-March when it was evident that we were going to see a surge in COVID-19 cases. We assembled a team team called the Peer-Based Review Team. And basically what we did is we came up with our surge crisis plan. And that entailed how we would care for patients, how we would isolate patients, how we would use our personal protective equipment, and how we would use all the testing modalities available to us. And to this day, we still meet daily to talk about issues as this whole crisis changes on a daily basis. I think the first thing we did was we decided that we were going to use a section of the emergency department, which had negative pressure rooms, to isolate our first patients. And when we'd outgrow that, we came up with a critical number to which we would move to another unit, which was our clinical decision unit, where we held even more patients. And when we outgrew that, we moved to another part of the hospital, which serves as our COVID unit today. And doing that, we were able to isolate the patients and use a standard set of staff and to be able to care for these patients and yet keep the rest of the hospital COVID-free and all of our associates safe and healthy. Over the last several months, there have been some studies that show that certain modalities may help treat patients with COVID-19. The first one that came out was convalescent plasma. And the theory behind that is that patients who've had COVID in the past develop antibodies. And if they donate their blood, the plasma can be isolated and given to patients with active COVID-19 infection. And this will help them recover. Since then, other medications have come out. One is remdesivir, which is an antiviral agent, and that helps slow down the replication of the COVID-19 virus. And that's been given to patients successfully to the point where one study showed that it decreased the length of stay in the hospital by its use. And then the third modality that has come out has been steroids. Steroids given early in the course help reduce the inflammation. And an Oxford study showed that using Decadron 6 milligrams a day for 10 days actually helps significantly. So here at CHRISTUS St.Vincent, we employ all three strategies. And of all those three modalities, all the researchers have found that when used early is best in the patient's recovery. So like the rest of the nation, we're using these medications very early in the course of the illness before the patient experiences what we call an inflammatory cascade. In the course of COVID disease, it's a very inflammatory condition that leads to multi-organ failure. And it's felt that if you give these medications together early in the course before the patient starts exhibiting inflammation and their inflammatory markers increase, you have a better chance of them recovering from COVID. So we become very aggressive in using all three of these together in our patients, and have noticed, just anecdotally, just looking back, our numbers are very small, but we have noticed that patients have less oxygen requirement, are more hemodynamically stable, and we've had less patients requiring mechanical ventilation. For the most part, most patients do qualify for all three treatments. With remdesivir, the big issue is renal failure. That's a contraindication to receiving that therapy. Plasma, there's really no contraindication unless somebody's had a really severe, life-threatening transfusion reaction in the past. And steroids, there's no major contraindications. We just need to watch their blood sugars and other signs of infection. The prognosis for a vaccine is good. The issue is the time frame of this. We're seeing now that many organizations around the world are working day and night to create a vaccine. There's some very good leads. They've done some small studies where people have been given a type of vaccine and have developed antibodies. The big question is safety and efficacy. So now they're in trials to evaluate for safety. We're not sure of the efficacy yet because we're not so sure how long the antibody response lasts, and that's going to be key to making this an efficacious medication, especially worldwide. You want a medication that doesn't require too many booster injections so that you can keep the immune response going. Kind of similar to the influenza vaccine, which is annually, because as this virus travels, it also mutates. The good news is they've looked at the mutated virus and they haven't seen any issues with vaccine efficacy thus far. The reason for that is because they're basing their vaccine on a certain component of the virus particle which doesn't mutate, but the body recognizes and develops a response. I think as the fall and winter seasons approach, we'll have to not let our guard down and even become stricter in the practices that we're practicing now. The reason is because influenza season will be upon us soon. It's going to be vital that everyone get immunized for influenza, as well as practice these isolation techniques, and as well as wearing a mask. The reason is because influenza and COVID are going to be a deadly combination and almost impossible to treat. So it's going to be essential that everybody get immunized for influenza as well as for streptococcal pneumonia, especially older folks, people who are in high-risk situations such as immunocompromised situations or in elderly homes. Their pneumococcal vaccine, their influenza vaccine are going to be up to date because those three illnesses can all occur at the same time. I would say you're increasing your risk of contracting the virus. Just as we have visitors to Santa Fe now that are coming from hotspots, we're starting to see illness. They're coming to Santa Fe and becoming ill, and we're hospitalizing them. Some of the cases that we've had here at CHRISTUS St.Vincent are people who just went out of the state for a couple days and came back. If I could pick one area where I see the most contact taking place, it's in large gatherings. And it doesn't have to be a large gathering of strangers. It can be a family gathering of 5 people or more. And we tend to see that the spread of COVID in those circumstances. I think if we all just buckle down and sacrifice just a little bit, but look at the positive things that COVID has brought about. It's brought more family time together. It's brought more time in the home. It's brought eating around the table back into practice. It's about spending time with each other. It's about learning together. You know, think of all the parents who are homeschooling. They're getting to know their kids better. It's brought about a lot more time outdoors and exercising. And so those are all the positive things that are coming out of this COVID crisis. It's brought cleaner air because less people are traveling and driving. Those things we should look at positively and realize that still have a ways to go, but if we learn to focus on those and enjoy them, we'll get through this crisis together.
Frost 19 is our unit that we have designated to take care of COVID patients. We have chosen a place that's separate from the general population so that we keep the general population of the hospital safe. And it also allows us a place to take care of our COVID patients that, like I said, is isolated. No, there's a different group of staff members that take care of COVID-19 patients. We are actually considered the superhero team. We all electively signed up to be a member of the superhero team, as they call it, and so that way we were taken out of the general population. We only serve the COVID-19 patients. The most interesting aspect of the COVID-19 unit that we have is that we implemented this thing called team nursing. The dynamic of it is that we have an acute care or an intensive care nurse, who works alongside an intermediate nurse, and then we also have a tech that's on our team. The idea that implementing this team nursing has created is you have to work together. And for me, it's been a rewarding experience and something I think that is going to be really, really phenomenal moving forward in the way that nursing is shaped possibly in the future. I never really had any fears going into the COVID-19 unit taking care of the patients. I think my fear was more my family had the fear. So I'm gonna be safe, Mom. Don't worry. I'll call you every night after shift and it'll be okay, Mom. We've got the right PPE. And that was the biggest component, I think, of me feeling safe, was the fact that our hospital did have all of the protective equipment that we needed to stay safe. I think my fear would have started had we run out of the PPE, like you hear happened a lot in New York City, but we never did. Our hospital management was very great in making sure that we delegated the PPE appropriately, and because we had that available, I felt safe. We had a patient, he was actually our first patient to get intubated, which means being put on the breathing machine, and that was COVID-19 positive. He had been in our unit for about 40 days now, and just to kind of give a little bit of perspective, for every day that a patient is in the hospital bed, it takes 3 days worth of rehabilitation to get back to baseline. So we knew that we'd have to send him to a long-term care facility for that rehabilitation. For that, however, he had to have two negative COVID tests. He'd already had one negative COVID test, and if we tested positive on the one that I was going to take, then that meant this poor man had to stay with us for another week. So I was really nervous, almost like taking the SATs all over again. I hope I passed this test. And so I swabbed the patient to see if he was negative. His results came back later that afternoon, and I just remember saying, "He's negative!" And then the whole unit, I didn't even realize they were listening to me, but maybe I yelled it that loud. The whole unit erupted in like cheers and laughter and, just an applause, almost as if we were at like a football game or something. And they were all excited, and they're like, "You hear that? You're getting out, you're getting out." We make sure that we take every precaution necessary to keep the people that are at the most risk separate from the people who are a potential risk. And even in transporting our patients who do end up being COVID positive, transporting them to our COVID unit, we have a special process that everybody from security to our ambassadors to nursing staff to our COVID staff, our managers, everybody, we just make sure that we follow that process every single time. I keep referring to it as a well-oiled machine, and I can't really describe it any other way. I mean, we just work so perfectly and so cohesively together that it's really inspiring. This is what we do. This is our job, is to take the public's health and they put that in our hands, and we know that they trust us with their health. And so we just want them to know that we're doing everything that we can to keep them healthy and to keep them safe and to make sure that we get through this all together.
Thank you for joining us today. We are so happy to share with you a little bit more about what we are doing to care for our COVID-19 population and our general patient population. If you have any questions whatsoever, please reach out to us on our Facebook page or on our website. Be safe and be well. Take care of you and your families, and be sure to always do those things that keep us safe. Wear your mask, honor social distancing, and wash your hands again and again and again. Thank you again. Be well.